In tonight's Ask the Doctor, we know people with underlying medical conditions are more vulnerable to the coronavirus and COVID-19. So I sat down with Northern Nevada Medical Center pulmonologist Dr. Aleem Surani for a Skype interview today. He talked about precautions people with lung disease should take to prevent COVID-19.
This thing is quite virulent. It's quite infectious. And so really you shouldn't be going out unnecessarily. You should only be going out to get your absolute needs in terms of groceries, gas, things like that. If you have somebody that can do it for you, that's all the better.
We also asked questions from our Facebook followers. Norma Jean asked, can you get the virus more than once? Dr. Surani says, to the best of his knowledge, most likely not.
For different viruses, antibodies can last a long time or a short time. There's a reason that we have to get a flu shot every year. And there's a reason that when you were young and you got chicken pox, you had a much longer immunity. Your body holds on to immunity differently for different viruses. At this point, we don't know how long that immunity lasts for the COVID-19 virus.
Dodie Broker wants to know, does C-19 cause long-term lung breathing issues? Dr. Surani says, unfortunately, we just don't know yet.
There is some evidence of diminished lung function. The problem is that you don't know whether that's a long-term effect or whether this is just a short-term few-week effect.
Tahoe Jeeper also asks, if we had the pneumonia shot, can it help against the coronavirus effects? Dr. Surani says it won't directly affect COVID-19, but it could help with complications if you get the disease.
The vaccine can sort of diminish the chance for receiving that superinfection, and if you were to get that superinfection, it would maybe be less severe. So it is definitely important for you to be up to date in terms of vaccination, particularly if you have chronic lung disease.
Saoirse Underwood wants to know, how does this virus affect asthmatics specifically? Dr. Surani says, like any lung disease, you're more vulnerable.
Particularly my severely asthmatic patients is make sure you're using your medication the exact way that it's prescribed. Make sure you have enough of that medication available to you in case of emergency.
And Dr. Surani says if you haven't already stopped smoking, now's the time to do it. Even a few weeks cessation can make a difference in COVID-19 recovery, believe it or not. Thanks again to Northern Nevada Medical Center and Dr. Surani. And thanks to you for all your Facebook questions. You could read more from our interview on our website or our 2 News app.